I now request the Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Shri Jagat Prakash Nadda ji, to address the gathering and share his vision and guidance on this landmark occasion.
Madam Nivedita Shukla Verma ji, the Secretary, Ministry of Health and Family Welfare, Dr. Sunita Sharma, the Director General of Health Services, Shri Vijay Nehra ji, the Joint Secretary of Ministry of Health and Family Welfare, Dr. Anil Kumar, the Director of National Organ and Tissue Transplant Organization, officers of the Ministry, representatives of the State Government and UT Administration, transplant professionals, members of donor families, recipients of organs, and representatives of NGOs and societies working in the field of organ donation, friends from the print media and electronic media, ladies and gentlemen. It is a matter of honor and privilege to be amongst you today on the eve of the 15th National Organ Donation Day, a day that celebrates the spirit of giving compassion, hope, and triumph of life over the loss. Organ donation is one of the noblest acts of humanity. In a world where medical science has made incredible progress, gift of an organ remains one of the most profound contributions one can make for someone else. As we all know, there is an alarming rise in the case of organ failure, posing a serious threat to public health and increasing strain on healthcare system. Every year, thousands of people, men and women and children, wait anxiously for an organ transplant. Despite the urgent need, there remains a significant gap between the number of patients waiting for transplants and the number of available donors. This is not due to lack of willingness, but often due to lack of awareness and hesitation rooted in the myths and misconceptions. That is why days like today are so important, which gives us a platform to spread the awareness, to encourage conversation, and to honor donors and their families. Each organ donor is a silent hero, someone whose selfless act transforms grief into hope and loss into life. I am happy to note that since the launch of the Aadhaar-based Noto online pledge website in 2023, more than 3 lakh citizens have pledged to donate their organs, marking a historic moment in public participation. This surge in the pledge registration reflects a growing awareness and dedication amongst the citizens towards the shared goals. Through the unwavering dedication of our transplant professionals, India achieved a remarkable milestone in 2024, performing over 18,900 organ transplants, the highest ever recorded in a single year. This is a significant leap from fewer than the 5,000 transplants in 2013. India now proudly ranks third globally in total number of organ transplants, behind only United States of America and China. I'm especially proud to share that India leads the world in the hand transplants, an achievement that showcases our nation's cutting-edge surgical capabilities and the unwavering dedication of our medical professionals. As we celebrate these achievements, we must acknowledge that there is a huge gap in requirement of organs and available donors. This stark gap signals the need to greater awareness, more public dialogue, timely consent from families, and robust system to support disease donation. One person can save up to 8 lives by donating kidneys, liver, heart, lungs, pancreas, and intestines. Additionally, countless more lives can be transformed through tissue donations. Let us make organ donation a Jan Andolan, a people's movement. Let it reflect the essence of Vasudhaiva Kutumbakam, the world is one family. Under the visionary leadership of Honorable Prime Minister Shri Narendra Modi ji, Government of India is continuously streamlining organ donation and transplant so that more and more citizens can benefit from it. We are committed to improving the infrastructure and availability of trained manpower to ensure timely and smooth movement of organs between cities and states and successful organ transplants. To make organ transplant more accessible, financial support up to Rs 15 lakh is provided to the poor patients for transplantation of kidney, liver, heart and lung under Rashtriya Arogya Nidhi. Poor patients are provided financial support of up to Rs 10,000 per month after transplant to cover the expenses on medicines. Kidneys transplant package has also been included under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Unhealthy lifestyle and food habits are some of the major factors leading to organ failure. It is therefore necessary to take preventive measures and lifestyle interventions. Ayurveda and yoga offer simple practices to strengthen our organs and boost immunity. We must adopt yoga to promote the well-being. Honorable Prime Minister Narendra Modi ji has time and again encouraged us for proactive steps towards better health. One such powerful message he has given is the call to reduce the consumption of oil by 10%, a simple and impactful step toward building a healthier, disease-free future. I urge each one of you, to take this small but meaningful action. It is not just about cutting down the oil. It is about making conscious choice to protect our health, prevent lifestyle-related diseases, and improve our overall well-being. On this solemn day, I extend my heartfelt gratitude to the donor families. Your courage and compassion inspires the nation. I salute the doctors, coordinators, nurses, NGOs, and institutions whose unwavering dedication makes these second chances at life possible. I also acknowledge the good work done by many states and union territories for augmenting organ donation and transplant. We must learn from the best practices implemented by the different states. Let us join hands and help save millions battling organ failure and honor India's age-old tradition of compassion and giving by pledging organ donation to build a future where no life is lost for want of organ. Once again, I thank you all for giving me a very patient hearing. Thank you.